Hi everyone, my name is Sofica Bistriceanu. I am a family physician, Ph.D. I would like to thank you for the opportunity to share here some data from my clinical practice. The title of my presentation is Depressing Thoughts Effects on Vulnerable People. Content of my presentation: human interaction general data, human interaction, the nature of product exchange categories, human interaction effects on them, general data, human interaction effects categories, personal emotional state variation, depressing thoughts effects on vulnerable people, a real case study, abstract, attitudes toward ill-mannered interactions between family members, burnout management, artificial intelligence utilization for a peaceful inner world, conclusion, and references. Human interactions general data. People's interactions are essential for exchanging goods, services, or ideas of interest. No one can live in isolation because they cannot now produce and balance everything. How they achieve this influence their life path and equilibrium. In addition, individuals interact with other living and inanimate things that can impact their inner world positively or negatively. The environment has a summative effect on human functioning. Choosing the best surroundings and effectively communicating with partners or collaborators fosters the personal balance necessary for achieving excellence in life. Human interaction, the nature of exchange product categories. Given the nature of product exchange among people, there are three categories: exchange goods, ideas, exchange opinions. Exchange goods that assure profit-driven business. This category is business-oriented. Exchange ideas, that means making money, that assure financial support for business growth. And exchange opinions, generating varied thoughts, usually for improving the personal emotional state, that means emotional support. Exchange opinions, category payable, another category non-payable. Non-payable, that means volunteering. Volunteering, that means community support, friends, loved ones, family members, volunteering for you. Human interaction effects on them, general data. When exchanging products necessary for themselves and their loved ones, people must interact virtually or face-to-face, communicating the quality and prices of their goods, while showing respect toward their partners. Furthermore, how they share their presence influences buyers and prospective relationships. Their verbal and non-verbal communication styles impact every participant in the relationship and ultimately affect their health. Human interactions depict their life paths. Human interaction effects categories. These effects are on business stability and advancement, on finance, personal growth, career growth, reputation, brand personal, on public health, society advancement, and inner world. That means personal health, emotional well-being. Personal emotional state variation. The inner world reflects the value of daily interactions with one's surroundings, especially with other people. Individuals exhibit behavior according to their genetics, environment, health, education, networking, and financial capacity to continuously update their knowledge in the increasingly competitive digital landscape. Educated people effectively communicate with others, and consolidate and expand their practices, ensuring a prosperous personal, professional, social life. Their collaborators, partners choose to continue working with them and maintain their relationships. Satisfied end users spread the good word about their providers, which enhances their reputation and return on investment, key elements for business stability and expansion, and their financial capacity. We can observe similarities in personal emotional states that enhance health. In contrast, uneducated individuals with impulsive reaction can damage the inner world of their collaborators and partners. Persistent negative thoughts influenced by improper interactions with them can affect personal health. Sooner or later, they will stop their collaborative work with ill-mannered people to protect themselves. Family members typically connect through love and friendships. Positive interactions with loved ones enhance our capacity, creativity, and well-being. Evidence from clinical practice indicates that sometimes a family can be a source of distress. A large family often comprises members from varied backgrounds. Their differing viewpoints on various topics can lead to contradictory discussions within the group. Those who feel offended may suffer in their hearts and minds, and persistent negative thoughts can lead to health issues. Depressing thoughts effects on vulnerable people, a real case study. Abstract. Background. Human functioning reflects interaction with animate and inanimate surroundings. Individual feelings vary according to their relations with them, interests, and their construction. The aim of this study is to highlight the negative impact of depressing thoughts on vulnerable humans. Material method. The author conducted a retrospective observational study in the community from 2008 to 2025 on the effects of varied thoughts on human function. Findings. In November 2024, a patient aged 75 called the family doctor for a decline in her health, including vertigo, fatigue following minor physical activities, and prolonged insomnia. Patient health history: type 2 diabetes from 1989, arterial hypertension since 1990, atrial fibrillation 2010. Patient social history: from 2010 to 2024, that patient experienced undesired interactions with her large family members, preceding her 3 daughters' separation from their husbands. Patient family health history: parents, brother, arterial hypertension. Action taken. The physician scheduled a home visit for this patient. The patient physical examination revealed signs of severe anemia, and she was recommended to undergo blood cell investigations. The patient laboratory data confirmed her clinical diagnosis, and transfusions were recommended. An interdisciplinary team manages the patient's disease in the hospital. No chronic bleeding was identified. Bone marrow function of the control of red cells was detected as inhibited. 2 months later, the left clavicle was broken under a minor physical exercise. The patient was diagnosed in addition with multiple myeloma. Results. In March 2025, the patient died in the hospital. Conclusion. Persistent depressive thoughts seem to harm bone marrow function in vulnerable individuals. Implication discussion. Usually, family members feel affection for their loved ones and vibrate with their emotional state. Outstanding accomplishments enhance their well-being, while failure in personal, professional, or social life provide them with sadness, which declines their health. For this patient, it seemed that her persistent upset mental activity was determined by the emotional suffering of her daughter's experiences divorce. According to individual construction, the negative emotional state harms specific cell functions in weak areas. Evidence in clinical practice showed that the persistent negative thoughts, which were determined by the loved ones who passed away, were followed by multiple myeloma. Negative thought energy seems to alter gene structure where possible. People must be aware of the potential destructive effects of depressing thoughts on cellular control. Informative programs are required. Attitude toward ill-mannered interactions between family members. A large family includes people with different genetics, education, and networking history that influence their behavior. Deceptive interactions between family members harm the end user's inner world, negatively impacting their health. Depressive thoughts following ill-mannered communication by repetition can disturb their equilibrium, leading to illnesses such as arterial hypertension, type 2 diabetes, and even brain hemorrhage or tumors. Avoiding unsafe communication to ameliorate and prevent such disorders would be better. Family members may provide remedial solutions for those who interact inappropriately with them. If they are ineffective, IT devices permit communication to be blocked. In this context, people who exhibit unconventional behavior can ask themselves, what happened? Why did this happen? They can review their past communication, identify their misconduct, and try to enhance their behavior. Attentiveness to the negative impact of improper communication on family harmony and stability is required. Informative programs are necessary. Burnout management. Burnout definition, causes, management. Burnout definition. Burnout is extreme tiredness or mental fatigue or physical exhaustion caused by working too hard or trying to do too much. Or another definition, burnout is having no energy or enthusiasm because of working too hard, or someone who shows the effects of this state. Another definition, burnout is extreme tiredness or a feeling of being unable to work anymore, caused by working too hard. Causes of burnout. Burnout can result from exceeding the tolerance limits for a family member's misconduct, continuously caring for loved ones who are suffering, continuously suffering from the loss of loved ones passing away, community member misconduct, for example, repetitive impolite interactions with neighbors, and another cause, working too hard in professional life. Burnout management. Since burnout generates depressive thoughts. Burnout of the management of burnout generated by exceeding the tolerance limits for a family member's misconduct. People's relationships in a family are usually lovely. Sometimes, slowly, they degenerate through bad behavior initiated by excessive drinking, eating, tobacco use, or usurpations in society, and medical conditions affecting perception, judgment, and actions. Their inadequacy in interaction with others harms the end user's feelings. Awareness of the effects of negative interactions must precede any potential separation due to wrongdoings. Advanced suggestions for promptly applying corrective actions to improve bad behavior are essential. Neglecting this aspect leads to disconnection. Informative programs in person or a virtual format are necessary. Management of the burnout resulting from continuously caring for loved ones who are suffering. Human transition to another life after death, imperceptible to us, could involve mental and/or physical suffering and necessitate material and emotional support from others, especially from their loved ones. Palliative care's best coordination program is key for a non-destructive, loving relationship between the person who will pass away and their relatives, friends, and other loved ones. Going away in peace and having loved ones remaining with good memories over time implies not experiencing burnout generated by excessive caring for them. Therefore, it is crucial a team ensures that the people suffering receive support. A team, not only an individual. Team members adopt a healthy lifestyle, including a regular sleep program. And mental and physical work must be balanced by virtual and in real-world recreational activities. 3 elements. Burnout resulting from excessive caring for loved ones who are suffering generates depressive thoughts, altering their health. Informative programs are required. Management of the burnout resulting from continuously suffering from the loss of loved ones passing away. People must accept their destiny. All come in greatness and pass on. Sooner or later, each individual will pass through another individual structured form in infinite space. Regretful feelings suffering from a definitive separation from their dear ones are a normal human state in challenging times. However, excessive, continuous standing and feeling pain can dangerously affect human functioning, accelerating their decline in life expectancy. Calibrating suffering through other distracting activities and providing network support helps them survive in critical moments. Management of the burnout resulting from the community members' misconduct. For example, repetitive impolite interactions with neighbors. Community members who exhibit misconduct in interacting with others alter the equilibrium of their intended recipients. Ill-mannered people's repetitive, harmful verbal and nonverbal interactions with their neighbors progressively disturbs the offended person's inner world, which declines their health. As an echo, an offended individual by an uneducated neighbor can extend their emotional negative tension to their friends and loved ones who resonate with them. Working too hard to correct an offender's bad behavior leads to tyrannies, which can extend and eventually generate burnout. Such inadvertent communication by ill-mannered community members must be recorded, and the local law must punish them. Corrective actions are required for everyday deceptive social interactions. Management of the burnout that result from working too hard in professional life. Working too hard in professional life can determine excessive tiredness, leading to sleep disturbance, which is a starting point for other bodily disorders. In addition, burnout due to working too hard without a balance by a healthy sleep program and other recreational activities can lead to improper verbal and nonverbal communication with family members, even with other community members, which disappoint them. Their depressing thoughts can sometimes lead to their separation. Attentiveness in establishing a healthy daily program in professional life is key to a successful existence. Aligning mental and physical activities with recreational programs is necessary. Artificial intelligence utilization for a peaceful inner world. In the digital era, IT advancements benefit people of all ages, offering informative, teaching, relaxing programs, and discussion of interest when needed. Watching on-demand movies and musical programs as a preference, admiring nature in a virtual space, and the varied art forms of celebrities when a person experiences difficulties in moving, provide a peaceful inner life, especially in a tumultuous mental life. Balancing distress with other exciting, enjoyable activities assists in maintaining human equilibrium. Conclusion. People's illusion of someone as perfect will lead to disappointment, as human can never attain perfection. However, tolerating dishonorable conduct in daily work is acceptable within some limits. Exceeding thresholds could lead to disaster in the receiver control of bodily function and social image. Group acceptance of an individual involves real and virtual interactions in line with social norms that do not harm personal feelings. Being trustworthy, respectful, and kind in interactions with others is essential for maintaining, advancing, and extending relationships and improving the well-being of all communication players. Human interactions are key to their existence. They need other goods or services they cannot create. Honorable people's interactions positively impact their lives, while deceptive communication lead to negative thoughts that decline their health. The energy of depressive thoughts seems to be implied in altering self-control at various levels, depending on the time of action, magnitude, and people's vulnerability. The opposite thinking value could minimize the effects of depressive thoughts. Artificial intelligence can help restore positive thinking as a source of well-being and health. At the end of this presentation, the audience will be able to recognize the power of persistent depressive thoughts to alter self-control in vulnerable individuals, identify the people interaction value as essential for their life path, and initiate informative programs in their community about the effects of various communication styles on their health and how they can enhance their lives. Thank you for your time and your attention.